Please welcome our veterinarian friend, Dr. Courtney Campbell, to the show.
Courtney!
So, you ready to hit up some hot headlines with us?
Yeah, let's do it.
When it comes to Facebook, it's always nice to make a new friend. But the question we're asking today is, should you ever friend request your own doctor or vice versa? Should a doctor friend request a patient? Or does that blur the lines between that sort of, I'll call it a somewhat structured relationship, doctor-patient?
I think it depends on the specialty, right? And it depends on that doctor and their patients. I don't think you can make a sweeping yes or no. I mean, I will say, Courtney, if I brought my dogs to a veterinarian who looked like you, I would be friend requesting every day. And you would probably be blocking.
Which is precisely, and you joke, but that's precisely where I think... where I think that it can be problematic.
Right.
Because then, you know, Courtney's supposed to, in the world of veterinary medicine, he's supposed to be providing care for your pet and, like, focused on that. Meanwhile, you're so distracted with how good looking he is.
Please.
And smart.
Listen.
And nice.
Oh, that's very sweet. But the truth is, here's the truth. We know that 75% of people who are on the internet right now use social media. Right. So we know it's here to stay, and people are going to use social media to contact their doctors. And it's just it's going to be integrated as part of it. And so the hospital either needs to decide this is something we're going to embrace, or they're going to need to establish a policy. Says, hey, listen, that way, if there's somebody who says, Dr. Travis looks so good, and you say, you know what, hospital policy is that I can't be friends, you can blame it on the policy and nobody gets offended.
But don't you think that's restricting our social liberties a little bit? I mean, I think, doctors are people too. And I mean, I will say again, this is where it's specialty dependent. I have a lot of patients of all ages that I am friends with on Facebook, on Instagram, Twitter. And I will say that from my perspective, I like it because then when they come into my office, I say, oh, I saw you and your family took a great trip. I saw the pictures on Instagram, and it kind of helps me keep up with them.
Let me ask you this. Yes. You are a female OBGYN. All of your patients are females. If you were a male OBGYN, do you think it would still be appropriate to be friends with all your female patients on social media? I don't.
Right.
I think that is a very blurred line, and I think it's incredibly awkward. And I think that it's a case-by-case basis. But I do think that it's, you know, maybe, Courtney, your point, which is valid, is certainly in a hospital setting, having some rules in place may end up being necessary because there are just too many things that can happen that can go wrong.
I think a lot of patients, especially younger patients, do want different ways to access their physician. And I absolutely have had patients, again, of all ages, but especially younger patients, direct message me on Facebook with a medical question, direct message me on Twitter, securely with a personal question. And I always say, if you're having a medical emergency, a direct tweet is probably not the best way to reach me. But again, this is, it's at your disposal, so it's another way to communicate.
I think it's to each their own, and I think all doctors practice medicine a little differently. And some doctors are probably more comfortable with that than others. And then there's people like me who I don't even have a Facebook page, so I don't even know how to friend someone.